We do have some time for questions and discussion. So just a reminder, feel free to put your question or your comment in the chat, or you can raise your hand and we'll look for you and make sure you can unmute yourself and speak your question or your comment. I did get a couple of questions about the toolkit in the chat. And just a reminder, the toolkit and the implementation guide is not yet on our website. We are launching that at the conclusion of this week's workshops. That way we get folks to join our workshops, and we want to make sure it's nice and ready and complete for all of you to use right away out of the box. So look for that on our Train the Trainer website shortly. I want to invite Shantala Ahanya, one of our HAI program infection preventionists, to join and moderate our discussion today. And I think she just turned her video on. Hello. And then I did see something come into the chat. Let's see. We have a question about we use Relias for education to our staff. Is this something that we can upload to that system? And so there's a question there. Maybe we can kick off with that one, Shantala.
Thank you, Erin. Not sure about that. We can, I think it's, if you can check with your IT department, and maybe they may be able to. I think I would reach out to your IP department first, but we can also look into if there is any feasibility on that. With that, I think it's great presentation for both Shannon, Aurora, Sophie. I think one of the questions I have for you is, this is for Shannon, why it is so important to share the data, the feedback to the frontline staff? Why do you think that is a very crucial to sustain the program?
Yes, Shantala, that's a great question. I think there's so many reasons why this is important and so crucial. Initially, I think it just makes the staff aware that there are gaps and areas for improvement. And then from that, it really generates this, form of communication that you can have with your staff to really get a better understanding of the reasoning behind why those gaps might be occurring. And from that, you can then create solutions and work with your staff to really work on implementation solutions to help with IPC practices. Is there anything else you'd like to expand upon that?
You covered it, Shannon. I think the examples I can give example is some of you have challenges with your leadership, right? So when you're asking for tools or asking for supplies, you may have okay, I don't see any issues, so why do I need to spend money here, right? So this is when you're providing the feedback to your frontline staff, that also you're also providing the feedback to your leadership with what the data will speak. So if your hand hygiene practice is only 50% before the staff entering the room, then we really need to look at what's the gap. Do we have a hand sanitizer dispenser outside the room? Or if it is available, but is it full? Is it broken? Is it working? So these are the elements you will start looking at when you provide the feedback to your, not only for your frontline staff and to your leadership. I think anything else, Aurora, Erin, Sophie? Okay. Aurora, I have a second question for you. How often do you think this feedback needs to be provided to the frontline staff?
Thank you. That is a great question, and it depends on the facility. I mean, you can do them daily, weekly, or monthly, but it is important that you do find consistency in reporting this feedback to your staff so they know in which areas they have improved and which areas might still need a little bit of more work. You can also, you can post it on your bulletin board or whiteboard or report it monthly, depending on your facility, which way is more accessible to more of your staff so they can be updated and know how well they're doing, and so they can receive that feedback is very important. Do you have anything else to add, Shantala?
Thank you, Aurora. I think there is a couple of things which my experience since I've been I know many of you who are on the attending this session today, and I have been to many of the buildings. I have seen several examples, so very good examples. Some of them had posted on their screensaver as soon as they open up the computer. So then it shows up on the screensaver on their the feedback, like what is their hand hygiene rate, or what is their UTI related rates. So it's up to the facility. What is feasible? What does your staff respond to, right? Some people will respond to your administrator walking around, your DON walking around and talking to them. Some people will like the group text, so you do the group text. Some people will like the a weekly letter, a monthly newsletter. So many, it's a very creative, you're all creative people. So you know what is needed for your staff, and we can discuss if you have any concerns, so we can discuss more during our office hour for other ways to engage your staff. Especially one of the question was, the response was time constraints, right? So you have a very limited time to train your staff, especially you're not bringing them specifically for the training. So you are just pulling them when they're on the floor to provide the training. What do you do in that moment? So even with just giving an examples of the hand hygiene, right? So the hand hygiene, break it down to, okay, so today we are just going to talk about why hand hygiene is important before they enter the room. That's all you're going to talk about because you are limited time. So tomorrow, you can talk about the other part of the hand hygiene once they are in the room, with the opportunities for hand hygiene. So you can talk about only for CNAs for today, and then tomorrow it could be EVS staff. So you can break it down. So even with the module, what Shannon, Aurora, and Sophie, they showed, it's a very user-friendly toolkit where you can break it down, print it out, and then provide the training to your staff. Erin, I'll pass it back to you. Do we have any other questions?
I don't see any other questions, and I'm wondering if any of our instructors have any direct messages directly to them, if you can bring those up now. But perhaps we can talk about some next steps on the slide, Joel, if you can pull that up. And then if there are further questions, we can come back to that at the end.
Real quick, Erin, I see one
sure.
in the chat.
Oh, okay, great.
Place to place hand sanitizer outside the room or inside? So I think our educators or Shantala might want to take that one.
Sophie, what was the question? Can you repeat the question?
Absolutely. Carmen asked in the chat, where is the best place to place hand sanitizer? Outside the room or inside the room?
So it depends. It depends upon your patient population. If you have a dementia patients, if you have some non-compliant patient, we have seen where they try to pump in and then they feel like it's, oh yeah, I can drink it or I can taste it. So they really don't know. So you really need to look at your, do your risk assessment for what kind of patients you have in your building. And then you can place it outside the room of each room, or you can place it just inside the room where it's a both exit and entry, they have easy access. Don't place it all the way behind the curtain where they cannot reach it. I've seen buildings where residents buy, they have boxes of from Amazon, and the staff cannot even get to the hand sanitizer. And sometimes you have sink in the room, but that sink is easily accessible. So again, so before you place it, so do the walkthrough. What we always recommend use workflow when you're a CNAs or when you're therapy staff, whoever is going inside the room, just do the workflow to see if I had to do hand hygiene, is it the right place? So there is no one recommendation for a facility. It's up to each facility depending upon the patient population. And also the guidance is during COVID, I know we had hand pumps everywhere. So then you also need to look at now the CMS also looks at where have you placed your hand sanitizers, right? If it is too many, like you also need to look at the fire code. So how many you can place. So work with your facility team, work with your staff, and to see how many hand sanitizer pumps you can place and where is the best place to place it to. I hope I answered your question.
Carmen says, perfect, thank you. So, and I think Chantal, you always give very thorough responses. So I think very satisfied customers here. All right, maybe I missed another. If Sophia, have you seen any others in the chat?
I haven't.
Okay, great. So
We're good.
again, if you have any comments or questions, feel free to place that in the chat or raise your hand. We'll call on you to unmute. Joel, maybe we can show the next step slide just to get folks oriented to what to expect. So when you close out of today's workshop, you'll see a pop-up come up or another browser come up with an evaluation. We hope that you will take some time. We would love to get your feedback. So take a moment, let us know how it went today. We definitely look at each and every one of your comments. So we appreciate if you can just spend a few minutes filling out that evaluation after today's webinar. We encourage you to take a look at the toolkit when it's available at the end of the week, as well as the recordings we have of our IPC training modules. Again, if you're you're ready to go, but you want to spend a little bit more time looking at the curriculum, we do have the recorded trainings and the slides on our website right now on our resources page. So take a look at that. And again, the toolkit will be released at the conclusion of this week's webinar, along with the slides and the recording from today. Note that we have 2 more sessions that we're offering this week on Thursday and Friday. We'll present the same content as we did today, but feel free to hop on to listen again, or you can invite a friend to register and join us later this week as well. As was mentioned, we do have office hours next week, Friday, July 28th from 11 to 12 p.m. You can find the registration link on the slide, and Sophie will get that. She's already got it in the chat. So if you haven't registered already, go ahead and click that link right now. It's a really easy process. And we'll see you on Friday next week for that. You'll hear from some CNA training programs or facilities who have implemented CNA training programs in their facility. You can pick their brains on how they did it, get some ideas for your facility. You can also bring any additional questions that you have, and we'll also address any questions that we get this week that were kind of like FAQ. That way everyone has access to those answers. And then as a reminder, we do have one final Train the Trainer workshop series in August. We'll focus on IPC curriculum for EVS staff. We're really excited to launch this curriculum. It's been a long time coming, so we hope that you come back next month. Again, they are Train the Trainer workshops, so we don't want EVS staff to come, but we do want those staff who are responsible for training EVS staff. So we'll orient you, similar today, we'll orient you to the curriculum, the toolkit, and you can ask questions about how you can implement a training program for EVS staff in your facility. Again, bookmark our Train the Trainer website. You can access registration links to the curriculums, the toolkits, recordings, and more on that website. And again, we'll get that in the chat. Sophie's on it. She's already got it in the chat. And if you can go to the next slide, we'll talk about CEs. As a reminder, you will get all this information in an email, so you don't have to take all your notes right now, but just to go over how to claim your CEs. If you registered for today's session, you will get this emailed to you. So make sure you check your email box for this. So HSAG is the CE provider for this event. We're approved to offer 1.5 contact hours by the California Nursing Home Administrator Program, as well as the Florida Board of Nursing. Do note that the Florida Board of Nursing and the California Board of Nursing or Registered Nursing have reciprocity. So the nursing certificate will be accepted by California. It will apply to both RNs and LVNs. To receive your certificate, you'll access HSAG's Learning Management Center. You'll either click the new user registration link if you're brand new to the CEU system, or you'll click the existing user link if you've taken courses with HSAG before and have received CEs. If you're new, you'll set up an account. It's a really easy process. And once you have access, you'll input your name, your license number, you'll answer one question, and then you'll have access to your certificate. If you don't need CEUs today, but you do want a certificate of completion, follow the same exact steps. If you're a new user, click the new user link. If you're an existing user, click the existing user link. Instead of license number, you'll enter CA for California, and that's what will show up on your certificate. You can also choose any state you want for your certificate if you're joining us from out of state today. And additionally, you can always go back into your account and access your certificate at any time. We encourage you to do this by September 30. That way you have your certificate ready to go. If you do have any questions, you can contact Deborah Price at dprice@hsag.com. All right.
Erin?
Yes. Do you see a question in the chat that you want?
Yes.
Okay,
Um,
let's do it.
So Fredlin is asking question, these are just samples or tools if we want to use them correct? Like can they use them exactly? They can print them out and then use it.
Definitely, and I'm nodding, so I'll respond. Yes, you can use these tools out of the box, or you can get creative. Kind of pick and choose, just how Shannon and Aurora demonstrated. You kind of choose the slides you want to talk about that day. Whatever works best for your facility and for your CNA schedule, you can get creative with this. We do have some tips for using the toolkit in the toolkit itself. We do ask that you don't manipulate the slides, but definitely, you can use it however you need to use them. And then team, feel free to chime in with any other notes too.
Yeah, I think you really covered everything, Erin. I think just get creative with it, use what works for your specific facility, and have fun with it.
Yeah, you'll notice, we developed this content in the time of COVID, so it was developed for a virtual space, and we struggled with getting engagement from, this virtual audience. And so we tried really hard to incorporate knowledge checks and different kind of thought questions to really get CNAs not just thinking about, how you do certain procedures, but why we're doing certain IPC practices. And we hope that that really comes through as you go through the modules. And as you teach, to your CNAs, one of the things we wanted to focus on too was really building this safe space for CNAs to ask questions of you, ask questions, directly to the leadership, and creating this kind of community really for CNAs to be able to voice their concerns. And so again, we hope that comes through in the curriculum, and we hope that that is an aspect of the curriculum that you appreciate. And so we would love to hear later on, if you do use the curriculum, let us know how it went. We always appreciate constructive feedback too.
I think, Erin, so some of the facilities, they have used this as a new hire orientation, your annual orientation doesn't, so that's part of it as well. Also, reaching out to your registry staff, right? Some of you have a registry staff, and letting them know that, hey, you need to undergo this training before you come to your building, so you don't have to worry about their practice, and standardizing the practice within your own corporations, so within your own building. So I think the Liz says, did you say this can be put on Relias Learning? Not sure about whether, I think it's reach out to your IT team. They if they can, but we can find out. We'll bring it back during our office hour. So at this time, we don't have an answer for that, but we will bring that information back during our office hour.
And I'll give you a preview. We are trying really hard to get this curriculum online as online self-paced modules too. So if you're unable to get it on Relias, we're going to figure out a way to get it on our end in our learning management system. And maybe you can kind of forward your staff to that. But that's spring 2024 is our aim, but just a little sneak peek for you all today.